right, welcome everybody to HIMSS 2021. I am so excited. I'm your host, Sean Doe, and this is the Citrix Ready digital event for HIMSS 2021. You're going to hear from several Citrix partners about how they complement, enhance, and extend the Citrix solutions in healthcare IT. But first, we have an amazing guest. Whoever booked this guest did a solid job. We have Christian Boucher, who is the Chief Healthcare Strategist here at Citrix. Christian, welcome.
Thank you for having me, Sean.
So, Christian, I was so excited to see you on the booking sheet for this event here. And you're the Chief Healthcare Strategist here at Citrix, but you have to tell me, what is the Chief Healthcare Strategist responsible for?
Essentially what it means is that anything and everything regarding healthcare and Citrix, I get involved in some aspect. So whether it's working with our customers and having conversations around how our products can improve some of their operational workflows, or working with partners like Google or Microsoft, or specific ISV partners like Epic or Cerner or Meditech. So when it comes down to what I do, it really depends on the day and what our biggest challenges are for that quarter.
Okay, and our viewer is definitely going to recognize some of those names that you've been talking about. Medicare, Allscripts, Epic, the huge ISV vendors, obviously in healthcare IT. But Christian, what I really want to know is like Citrix's play within healthcare IT. Tell me what the footprint is, maybe is the better way to phrase it, about Citrix in healthcare.
That's a good question, because I think when you look across the ecosystem, not only with our ISV providers who leverage our solutions to host many of their hosted solutions, but in our specific customers, we probably have about a 90% rate of successful installs for many of those solutions. So whether it's on-prem installations or cloud-based hosting of our solutions, we look at not only how those solutions are integrated into the core EHR systems, but also all the rest of their ancillary applications. So whether it's interacting with PACS systems. So when we look at our total penetration in the market, I would say we are we hold a significant footprint in the arena.
And Christian, I want to get numbers here, and I really want to hold you to some numbers, because every time I go to the doctor, and I know what you're thinking, Sean, you're a picture of health. Why do you go to the doctor? I know, but I do go to the doctor, and they always seem to launch, like, let's just say Epic, for example. It, to me, always seems to be in a Citrix workspace or Citrix environment that they're launching Epic. Do you have any type of numbers as to what that penetration is?
Well, we don't like to get into specific numbers because they do shift on occasion, but I would say that the vast majority of Epic implementations are installed via Citrix. And when we say vast, we're probably talking to 80 to 90%. On the hosting side, like with Cerner hosts all their solutions in Kansas City running on our infrastructure. So I can say that 100% of all customers that interact with Cerner utilize our products to get to that solution. Allscripts hosting as well utilizes our solution to deploy, and most of the customers that we interact with that leverage it on-prem are also using our solution to deploy it.
Gotcha. And Allscripts right there in your hometown, isn't it? Is it based there in Boston?
Yes, we have a few over here, Athena as well, and Meditech.
And here's some trivia for you. Actually, we're going to maybe we should have a trivia contest at the end of this. I've been to the Cerner campus in Kansas City many years ago, and one of the folks that worked there owned a barbecue restaurant, and he took me out to his barbecue restaurant too. A little factoid for you. Impacts the HIMSS event, zero. Complete zero value add to that story, but I wanted to get it out there. So tell me now, Christian, everybody's cloud. It's cloud. You cannot get away from it. But I want to know from you, being the chief healthcare strategist for Citrix and Citrix Cloud in healthcare, what does that look like?
Well, Citrix Cloud and Healthcare really just extends the capabilities of what most organizations leverage on-prem, but it also allows you now look outside of delivering just on-prem apps, whether you're looking at SaaS solutions integrating into that unified digital workspace, or you're looking to integrate, some different shared folder locations or folder services, whether it's a box or whatever flavor you decide to choose as an organization. But what our goal is to simplify the configuration and the architecture for our customers. One thing that we realize is that Citrix is not we'll call it a plug and play solution. It takes some architecture to make sure it runs well. With our Citrix Cloud, we can make sure we deliver that solution in perfect harmony across your ecosystem, and also give you the DR functionality and allow you to stop worrying about those specific resources in your data center, and allow you to gradually move to cloud as you see fit.
Gotcha. And speaking of which, in that data center and public cloud mix, healthcare, I assume in healthcare IT, with the interest in cloud and cloud curiosity, if we can call it, do you find that a lot of healthcare environments are maintaining on-prem environments, or are they going full steam into the cloud, or is it a kind of a hybrid mix?
I would say it's a hybrid mix, and it will probably be so for some time. Now, there are some organizations that look at cloud as, that's their first choice moving forward. If solutions that they're bringing into their organization cannot support cloud, maybe it doesn't mean immediately, but if it's not in their roadmap, they won't look at it. And there's some organizations that are a little bit more hesitant. So
Gotcha.
When we look at the way we developed our solution, and we allow you as a customer to decide when and where and how you do that. So if you want to keep, certain EHR platforms on-prem, you can. But if you want to look at, moving other solutions to cloud services, where you host your resources is really inconsequential to, how we support you. We give you the flexibility to consume on demand wherever you want to deliver the best value and experience for your customers, who are your physicians and clinicians.
Gotcha. So Citrix Cloud kind of is that layer, that ability that lets you be between the clouds. Yes. Between the clouds, from private on-prem to public cloud. Wow, what a genius catchphrase that is.
It is.
Hey, Christian, I'm going to take you back a little bit, because what I want to get into now is some of the core use cases for Citrix in a healthcare environment. So back in my day, we always used to say that the clinicians would wheel around the computer on wheels. You remember that? And it was called the cow, and it was always, here comes cow, grab a cow, and things like that. And I understand they don't use that terminology anymore. But when you think of those clinicians in those core use cases, what comes to mind? What should I know?
I think one of the challenges we had as a healthcare ecosystem is, once we did digitize records and how those workflows were developed to work in a digital plane. So most of the time, if we go back 20 years ago, doctors carried around charts, nurses had them on the floor. If patients were admitted, they had them readily available, and that's where everything happened. What we realized when EHRs came into play is that many organizations looked at those workflows as they stood into, with paper charts, and we'll call them legacy workflows, and tried to replicate them on the digital side. And what that did is really not leverage the utilization of technology the way they should have. It was supposed to expand those workflows, give you more possibilities on how you can be more nimble or more efficient. So what we've seen is organizations looking at our technologies to help bring in various technologies. Now, you mentioned, cows, or WOWs, as some organizations call them, workstations on wheels. That was like the first step into utilizing mobile technology to jump in and out of solutions. And we allowed organizations to deploy virtually to those workstations, so they didn't have to worry about constant configurations or security breaches, someone walking away with a laptop. The data never lived on site anything. But now we're seeing extended workflows, whether it's leveraging iPads or tablet-based devices for certain workflows, and even some smaller devices like smartphones to work in like phlebotomy workflows. So as we go through, being able to enable organizations to consume on demand on the device they want to really gave them flexibility to deliver better experiences to their end users and allow them to consume the way that best fit their needs.
Right. And I think you touched on security, and that is a huge point, because you may remember, this goes back several years ago in Boston, our hometown, a clinician left a laptop on a city bus, on an MTA bus or MBTA. And there was all this concern about the healthcare records. But if the healthcare records don't exist on the endpoint device, then there's nothing out in the wild, is there?
Exactly, and that's been one of our strongest use cases. I mean, we think about, for years we've talked about that we're not a security company, but we do a lot of security things. I think we're looking at that standpoint, because when we look at how organizations deploy security solutions within their organization, they are trying to leverage any piece of technology that allows them to enable security feature sets, but not negatively impacting patient experience or physician experience. And
right.
I think those things, two things are tied together. So if we can, layer on the security of that virtualization layer where data never really leaves the data center or wherever you decide to keep that data, could be cloud, but it keeps it, fortified behind your firewalls and all your security measures. You never have to worry about data leakage and or the possibility of something like that happen with a device with hundreds or maybe thousands of patient identifiable information records are sitting around for prying eyes.
Right. I don't want creepy Larry looking at my healthcare records just because somebody left a laptop, on the MBTA bus in Park Square or something like that. But another one that's becoming popular in the healthcare industry, and if you're not in healthcare IT, first off, why are you tuning into this? But if you're not in healthcare IT, think of your own experience when you go to the doctor and how they just tap in, tap out with their authentication badge, and the workspace launches for them, and they've got your medical records right there and they can go to any office and get this experience and wheel the carts around. It's just such a seamless experience for that clinician, doctor, healthcare expert. But something that I see happening today is a lot of mergers and acquisitions in healthcare. Tell me about that. Is Citrix helping that, enabling that in some way?
Again, that is one of our key use cases within healthcare. I think in general across all verticals, but the ability for an organization to over the weekend or overnight onboard hundreds, if not thousands, of employees by delivering that secure workspace with all the things that have already been built makes it makes IT's job a lot easier. And that was one of the tools that I used when I was working back on the provider side, as we were looking to acquire physician practices or stand up new verticals within whether it was oncology or cardiology practices. We were able to literally onboard physician groups over a weekend and not worry about all the security challenges they had in their old mom and pop private practices. We were able to deliver that secure workspace, not and then come in after the fact and rebuild all their infrastructure from the ground up. But our goal was to get those physicians up and running as quickly as possible without worrying about we'll call it dated solutions many of them had running around in their practices.
Yeah, and back when I was working on the provider side of things, it was the carbon paper that we had to really maintain. That was the big challenge for me. Christian, I know we're running out of time, and our executive producer is giving me the wrap sign. But what I want you to do is, if you could, take a look in your crystal ball, and I've got my crystal ball, tiny as it may be. Take a look in your crystal ball and tell me What do you think some of those top 2 or 3 trends are in healthcare IT coming up?
Well, what we've learned from the pandemic is that many organizations are looking at work from home in a different light now. It may not be something that was as limited as it was previously. I think organizations had a challenge because of the culture in healthcare that if doctors and nurses have to be in work, everybody should be in the office. But I think what they realize is not only people can do their jobs remotely, but some of them are more efficient. And in some aspects, when it comes down to offsetting costs, there may be opportunity there to improve the bottom line for these hospitals, which work on very short margins to begin with. So that is a huge one. We're having a lot of conversations with customers about how they can take and replicate that experience of the in-house experience and move it remotely. So it's again getting back to that consumption on demand. I can access everything I need to do my job, whether I'm at home, if I'm in the office, if I'm on a remote work site, or I decided to take a little trip to well, I guess we can't travel too far these days, but if I decide to take a vacation someplace, I can still access all those solutions the same way. And the other piece is telemedicine, and we're seeing a huge tick up in not only the ways in which customers are asking for it, but we're seeing various differences in how organizations are deploying it. Some are looking at their general practitioners to just have every other day they work from home and use video conferencing. Others are building out entire practices around telehealth. So when we look at those use cases and how Citrix can help those organizations, not only because, again, the EHR is one part of what it takes a doctor to do their job. There are various other applications, various other data repositories, and various other technologies that are required just to, we think about just doing HR stuff. So how do we take that user experience and then bring it out to those telehealth doctors so they can still do all the other things they need to do besides just interact with the EHR.
Right, and focus on what they need to focus on, which is providing services in healthcare. Not worry about the technology that's running behind it, because it's just a seamless experience anywhere, any device, any, even for the healthcare clinicians. So that's amazing.
That's one of the big things that we have looked at, and I've always been this way, is we start with a user and I work our way back to the technology. Usually the solution works. We cannot look at just the technology and try to create workflows to deliver that. With Citrix, you can actually, you can have 3 different units in a hospital work 3 different ways and not really changing the way you deliver the technologies. It just works and allows you to kind of customize those experiences and make sure those users, that user population, is getting the specific requirements they need and nothing more, nothing less.
Yeah. And Christian, man, what a great way to kick off HIMSS 2021. I really appreciate your time. This was such an enlightening conversation for me. It was such a great treat to have you on the program. And for those viewers who are tuning in, don't forget, HIMSS is running all this week, and then the digital event runs this week as well. But then Citrix Ready is also running it after HIMSS. You're going to hear sessions from partners like Chrome OS, ControlUp, Flexible IT, NVIDIA, Wacom, Strategist, more and more partners talking about graphics and desktop apps, monitoring and remediating the end user compute. This is the experience Christian was just talking about, being able to see the problems before the clinicians actually experience the problems, the security controls, the simplifying access, and yes, Christian, even printing, because printing is still such a big part of healthcare IT. Christian, man, I can't thank you enough for being here. This was such a great chat, and I wish you well, my friend, and I hope to have you back on the program sometime soon to talk more about healthcare IT.
I'd love to come back, and again, thank you, Sean. It's always a pleasure.
All right, Christian, go Pats.
Go Pats.
We'll see you soon. All right, everybody, keep tuning in. Until then, bye-bye.